You know, when you think of an asthma attack, you probably picture someone struggling for air. But what's really going on inside their lungs? It's so much more than that. So today, we're going to take a journey right down into the respiratory tract to see this super complex chain reaction that we call bronchial asthma. All right, let's get into it.
So here's the plan. First, we'll nail down what asthma actually is. Then we'll get into the triggers, what sets it all off. After that, we'll look at the body's wild chain reaction, see how the airways physically get blocked, and wrap up with how doctors actually classify this thing.
And look, this is a big deal. We're talking about something that affects up to 5% of all adults. That's a huge number of people, which makes understanding this stuff really important for millions of us.
All right, let's jump into our first section, defining bronchial asthma. And right off the bat, you need to know, this is way more than just having trouble breathing.
Okay, so here's the official textbook definition. And yeah, I see those words. Chronic inflammatory disease, hyperreactivity. It sounds super technical, I get it. But stick with me. We're going to unpack what all that stuff actually means in plain English.
So let's break that down. First, you've got chronic inflammation. Think of it like your airways are just constantly on high alert. This constant state of readiness leads to bronchial hyperreactivity. Basically, your airways totally overreact to things that other people wouldn't even notice. And that overreaction, it causes a reversible obstruction. The good news is, reversible means it can be treated. And what does all this feel like? Well, that's where you get those classic symptoms, the coughing, the wheezing, that awful tightness in your chest. And for some reason, it loves to show up at night or first thing in the morning.
Okay, so that leads us right into our next section, the triggers. What kicks all this off? And this is where it gets really interesting, because asthma is what scientists call polyetiological. Total mouthful, right? All it means is that there's no single bad guy. It's a whole mix of different things working together.
And this really breaks it down perfectly. You've got two sides to this story. On the one hand, you have the internal factors. This is like the hand you're dealt, your genetics. Things like a hereditary predisposition, that hyperreactivity we talked about, and this thing called atopy, which we'll dig into in a sec. Basically, your body is primed for it. Then, on the other side, you have the external factors. These are the things that actually pull the trigger. We're talking allergens like pollen or dust, viruses, chemicals, even stuff like stress or a cold front moving in.
So let's focus on that one internal factor for a minute, atopy. What is it? In the simplest terms, it's an inherited trait that makes your body go overboard producing a specific antibody called IgE. So when someone with atopy breathes in something totally harmless, like cat dander, their body freaks out. It sounds the alarm and starts cranking out all this IgE, basically setting the stage for a full-blown allergic reaction.
And that brings us to the real drama of the story. Section 3, the body's chain reaction. We're about to go microscopic and watch the incredible battle that happens inside the airways the moment a trigger shows up.
Okay, this is super important to understand. The inflammation we see in asthma, it's not because of a bacteria or a virus you're fighting off. Nope. It's what's called a non-infectious inflammation. In a way, the body is attacking itself. It's your own immune cells, these guys called eosinophils, mast cells, and T lymphocytes that get all fired up and rush to the airways, causing all the trouble.
And this is how it all goes down. It's like a 4-step domino effect called the allergic cascade. So, step 1 is sensitization. The first time an allergen gets in, your body produces those IgE antibodies. It's like putting up wanted posters. Then, step 2, activation. The next time that allergen shows up, it latches onto that IgE and that flips the switch on your mast cells. Step 3 is degranulation. This is where the mast cells just explode, releasing a flood of chemicals like histamine. That's what causes the instant tightening of mucus. And finally, step 4 is reinforcement. Other chemicals get released that call in the heavy hitters, the eosinophils, and they cause more long-term damage and keep that inflammation going.
So, what's the immediate result of that chemical explosion? It's a triple whammy, and it happens fast. First, bronchospasm. The muscles around your airways squeeze tight, just like clenching your fist. Second, hypersecretion. Your airways start pumping out way too much thick, sticky mucus. And third, edema. The actual lining of your airways starts to swell up. So you've got squeezing, gunk, and swelling all at once. No wonder it's hard to breathe.
Okay, so that leads us perfectly into section 4, where we look at the anatomy of the obstruction itself. We've just seen the chemical chaos, so now let's look at the physical result. How exactly do the airways get blocked?
This chart lays it all out really clearly. The blockage isn't just one thing. It's got 4 parts.
Now, the first three, they're reversible. You've got the acute part, which is that muscle spasm, then the subacute part, which is the swelling, and the chronic part, which is the blockage from all that mucus. With the right treatment, you can deal with these. But then there's that last one, the irreversible component. This is the scary one. If the inflammation goes on for too long, it can cause a sclerotic process, basically scarring and hardening of the airway walls. That damage is permanent, and that, right there, is why managing asthma for the long haul is so critical.
So you can see how complicated this all is. The question is, how do doctors sort through all this to figure out what's going on with a patient? Well, that brings us to our last section, classifying the condition. It's all about figuring out which box to put it in so you can find the best way to treat it.
When you boil it all down, there are really three main buckets asthma can fall into. The biggest one by far is allergic asthma. That's mostly what we've been talking about. Then you've got non-allergic asthma, and pretty logically, there's a mixed form that's a bit of both.
So let's put the two big ones side by side, because they're really different. Allergic asthma, that's the one that usually shows up when you're a kid. It's set off by allergens, you'll see those high IgE levels, and it often pals around with other allergies like eczema. Now, non-allergic asthma is a whole different beast. It tends to hit in adulthood, and its trigger is often a respiratory infection, not an allergen. You won't see that IgE spike, and the attacks can be really tough, sometimes lasting for weeks.
And there are a couple other ways doctors slice it up too. They'll look at the severity. Is it mild and only happens now and then, or is it persistent and severe? And they'll look at the phase. Is the person having an attack right now, what they call an exacerbation, or are things calm and in remission?
So let's just wrap up with this final thought. We've seen it all now, right? The genetic lottery, the triggers in the air, that whole microscopic war inside the lungs, and the physical blockage it causes. After seeing that whole incredible, intricate chain of events, how does it make you think about something as simple as a cough or a wheeze? It kind of changes things, doesn't it? It just goes to show you, behind even the most common symptoms, there can be a whole universe